Hi, everybody. Welcome to our virtual presentation today on cancer screening. April is Cancer Awareness Month, so we wanted to share a little bit about this topic. So thanks for joining. I'm here today with Dr. Srinivasan, one of our newest primary care family doctors at KSB. Do you want to go ahead and introduce yourself?
Yeah, my name is Dr. Srinivasan. I am coming from Florida and Pittsburgh. I'm excited to join KSB, and I'm taking on new patients at the Town Square Center location. So, yeah.
So we're so happy to have Dr. Srinivasan as part of our team. Today we want to talk about cancer screening and cancer awareness. And I think a big question we get from a lot of patients is, why do we have to screen for cancer at all? Many of us put off doctor's appointments and we put off routine health examinations, but this is really something that we encourage patients to reach out and consider doing. It's really important because finding cancers before symptoms start is it's very helpful because it produces better results, and a lot of times treatment can be more effective. If you say to yourself, I'm going to wait till I get symptoms and then I'll talk to the doctor, chances are our prognosis or the outcome isn't going to be as good. So we really encourage screening, which is looking for cancers before symptoms even start. So there's some type of cancers that have their own screening tests, others don't. And developing new cancer screening tests is always an area of active research. And today we're going to talk about ones that we do recommend. And Dr. Srinivasan is going to kick it off by talking about colon cancer screening.
Awesome. So, yeah, let's start with colon cancer. 1 in every 23 men and 1 in every 26 women will be diagnosed in their lifetime with colon cancer. And the American Cancer Society has said that there's been over 152,000 new cases of colon cancer every year. And in the US, there's a total of 53,000 people that die from colon cancer every year. So colorectal cancer screening is primarily to find polyps and cancers prior to it becoming an issue. And previously, the age for colon cancer screening was 50, and that's been dropped down to about age 45 now due to people finding out that they're having cancer at a younger age. So there are a few different ways of getting colon cancer screening. And if you haven't done it by the age of 45, I'd highly recommend you do that. And like I said, you can talk to your primary care physician about this. And the 3 different kinds of screenings, and I'm sure you guys have heard, is one, it's called the Cologuard or the FIT DNA test. And essentially, that's a stool test where you send in a stool sample and they're checking for blood and hemoglobin DNA in order to see if there's any presence or issues within your bowels and within your stool. And if that comes back positive, then usually that would equate to you going back to see a gastroenterologist to get a colonoscopy done so that they're able to better visualize your entire colon and see what was causing the positive FIT/Cologuard test to begin with. This test will cost around $600, and if it's negative, then you should repeat it every 3 years. But if it's positive, like I said, you should go and see the GI doctor for a colonoscopy. Your second test is a little more invasive, and it's called a flex sigmoidoscopy. And it's a little different from a colonoscopy because they're only going to kind of visualize your rectum and the lower third of your colon. It's a little shorter than a colonoscopy, but it's essentially a very thin, long camera that they will go into the rectum, into the lower third of your colon to look for any cancers or polyps. And if they see anything, they're able to take it out. Now, as long as this is negative and fine, then you should kind of repeat that every 5 years. If you want to repeat it every 10 years, then we would recommend you doing the FIT test, the Cologuard, which I talked about before, every year with that. Finally, the best screening or the gold standard for colon cancer screening is called the colonoscopy, which is a longer flex sigmoidoscopy. So it's going to check the entire colon. It's going to check for any cancers or polyps. You're going to go in to see the GI doctor as you would for the previous test that I'd mentioned. And if they find anything, any polyps or anything of that nature, they're able to take it out right then, send it to pathology, and we're able to get a better idea and better visualization of the cancers or polyps or anything like that. If everything goes well with this, then they would recommend you continue screening every 10 years. And then if they do find any polyps or cancers or anything, then that may change depending on what the GI doctor says and what the pathology says. And that may be every 3 years, 5 years, 7 years, or maybe every 10 years, depending on what the result was. Like I said, the screening age has dropped down to 45. If for some reason you have personal family history of colon cancer, then that screening may be earlier. So please talk to your primary care about that. If you have your own personal history of IBD or inflammatory bowel disease like Crohn's disease or ulcerative colitis, that might also be earlier. So make sure you talk to your primary care today about getting screened for colon cancer.
So breast cancer, another really important topic. In 2024, it was an estimated 310,000 new cases of invasive breast cancer. That's estimated that's going to be diagnosed in 2024. So it is another cancer that is very pervasive within the United States. And for this reason, breast cancer screening has dropped now to the age of 40 instead of the previously recommended starting age of 50. This is a recommendation by the United States Preventative Services Task Force. Well, they put out a lot of guidelines that we follow. And so now the recommendation is 40. So that's something to keep in mind. I think a lot of people think it's 50, but really when you're 40, it is a good opportunity to have a discussion with your doctor about whether or not you should be getting a mammogram. The different colleges or different guidelines have different recommendations about whether or not they should be yearly or every other year. But at a minimum, screening should be every other year. And some people choose to have them every year, which is also absolutely acceptable. It is important to remember for women who have a first-degree relative that have had breast cancer. So a first-degree relative is a mom or a sister. It's important for you to start screening 10 years younger than that relative, than how old that relative was when they got diagnosed. So if they were 42 when they got diagnosed with breast cancer, you should have your first mammogram when you're 32. So keep that in mind. And I will do a little plug here for our Women's Health Center. We have a brand new facility with like state-of-the-art equipment and testing and a really comfortable women's health department where you can come in and get your mammogram testing done efficiently. And patients have been talking about how much they've enjoyed that experience. So I'm going to pass it back over to Dr. Srinivasan to talk about lung cancer screening.
Awesome. Yeah, so thank you, Dr. Johnson. So lung cancer screening is extremely important as well because it's the leading cause of cancer death in the United States, and about 1 in 5 people are going to die from lung cancer. And within the US in 2024, there were about 234,000 new cases of lung cancer and about 125,000 deaths from lung cancer. So it's really important, and I will talk about who needs to be screened and why you need to be screened. So the U.S. Preventative Services Task Force, or USPSTF, recommends screening for those who are age 50 to 80 who've had at least a 20-pack year smoking history. So that means you're smoking 1 pack a day for 20 years, or you're smoking 2 packs a day for 10 years. It somehow equates to 20-pack years. And if you're currently smoking, or if you quit within the last 15 years. And so they recommend an annual low-dose CT scan of your lungs in order to check for any nodules or, signs of lung cancer that may be there. So the number of cases continues to drop because of better screening, because people are quitting smoking or they're just not starting to smoke. And the number of deaths are dropping because of treatment and screening and finding it earlier as well. There's no great screening tool for lung cancer other than this low-dose CT scan. And so it's highly recommended that if you fall into that category of ages 50 to 80, having more than 20-pack year smoking history, or you are currently smoking or quit in the last 15 years, that you talk to your primary care about getting set up for this annual CT scan. And again, it's non-invasive. It's similar to an X-ray. You're on table. They use low-dose radiation in order to get slices and pictures of your lungs to get a better idea of if there is any brewing cancers or nodules or anything like that. And then that would be checked, annually depending on what it shows. And you would probably see a pulmonologist depending on what those results were. But yeah. And I'll pass it right back.
Yeah, the last cancer I'm going to talk about is cervical cancer screening. So the the lovely pap smear that most women are very familiar with. Cervical cancer, again, if we catch it early, outcomes are better. So we recommend screening starting at age 21, and you should get your regular pap tests every 3 years at the age of 21, and we do that up until you turn 30. And after you turn 30, we have the option to co-test for HPV, which is the human papillomavirus. And if you do your pap smear and HPV at the same time, you have the option to extend your screening interval to 5 years if your results remain normal. So some people, get a little bit nervous about this because they're like, oh my goodness, 5 years seems like a long time. But one thing we know about cervical cancer is that it's slow, and there's not a lot of evidence that promotes or supports checking annually for cervical cancer. Sometimes I get asked the question, why don't we screen under the age of 21? The old school thought was to start as soon as you're sexually active or as soon as you turn 18. But cervical cancer is very, very rare in this age group, and fewer than 1 in 1,000 cases of cervical cancer occur in this age group. So most women who become infected with HPV after they begin having vaginal intercourse, they're going to clear this infection almost all the time by themselves without needing any treatment. So research shows that cervical cancer screening in this age group does not reduce the rate of cervical cancer. And so that's the reason we don't screen, because we don't want to do unnecessary treatment. So that's cervical cancer. And then we have one more cancer we're going to go over.
Yeah, so I'll talk about prostate cancer. And there's no standard or routine screening test for prostate cancer. About 1 in 8 men will be diagnosed with prostate cancer during their lifetime. But the risks of the prostate cancer depends widely by age, race, etc. So normally it's a cancer that's seen in the older population. We normally don't think about screening until we're age around 65. It's very rare for men to get prostate cancer under the age of 40. Now, all of this would change depending on if you have some family history or personal history of prostate cancer. But again, this is something you would talk to your primary care physician about. Now, the screening tool that we use in the office is called a PSA lab test, and it checks your blood for prostate-specific antigen, which is a marker that's released by the prostate. Now, that itself does not mean that it's prostate cancer. That antigen can be released for a number of reasons, whether there's an infection of the prostate, inflammation, which is called prostatitis, if you have benign prostatic hyperplasia or BPH. But it's still important that you talk to your primary care about getting screened if you're at that age of 65 or older, or if you have any family history. And then that's something that we're able to get a screening lab test for. So normally around age 55, you'll start talking to your primary care physician, and that's an individual discussion that you would have. If anything comes up on your prostate screening test, then your next step would usually be to talk to a urologist and to figure out what the next steps would be, whether it's to continue screening a little closer, whether they want to do biopsies or something along that track. Okay.
So that kind of brings us to the conclusion of our cancer screening talk. You might be sitting there saying, oh my goodness, there's so many other cancers. And really, there's no screening test for some of the other cancers you might be thinking about, like ovarian cancer, endometrial cancer. We don't have screening tests for those. We have diagnostic tests, again, once symptoms occur, but nothing to look ahead of time. And sometimes people say, why don't you just do a whole body scan on me and we'll get this, we can know. It doesn't, I wish it was that simple, but the cost of that and the lack of effectiveness of that doesn't make, whole body scan testing a good option when it comes to screening for cancer. So if you are interested in getting any of this cancer screening and you haven't had it done yet, make sure you connect with your primary care provider. If you don't have a primary care provider, this is my chance to do a plug here for Dr. Srinivasan. you're taking new patients,
Yeah,
right?
I am. Yeah, I'm a DO, so I'm taking new patients, and I also do osteopathic manipulation. I see everyone from kids to adults to women's health and everything in between. So if you need a primary care or if you need anything else, just let the office know and let me know, and you guys can come and see me
So if
as
you
a new
want
patient.
to get hooked up with Dr. Srinivasan, call the physician referral line or click on the KSB website and follow those cues where it says find a provider. And yeah, we look forward to connecting with all of you. And we wish you the best health and have a great day.
Yeah.
Thanks
Take
for
care.
joining.